Welcome to the Optimize podcast from Prescribe Fit, where we explore the intersection of orthopedics, lifestyle health, and virtual care strategies to optimize patient outcomes and private practice success. Join us to hear from industry experts as we dive into the tools, technologies, and approaches shaping the future of orthopedic care.
Hi, listeners. Welcome to the Optimize podcast. I'm your host, Brock Leonti. I'm joined today by Dr. Russell Bodner, a board-certified orthopedic surgeon with over 4 decades of experience in lower extremity reconstruction. He emphasizes that preventive is the most powerful medicine, advocating for proactive care, surgical optimization, and value-based healthcare. Dr. Bodner also highlights how preventative strategies can greatly improve outcomes, explores patient optimization, and lifestyle health, and reflects on the biggest challenges in orthopedics. Welcome, Dr. Bodner. Hey, to just set the stage, we'd love to hear a little bit more about you. Share some highlights of yourself, a little biography, take some time to let us know who you are.
Yeah, hi, Brock. I'm an orthopedic surgeon. I live in the Midwest, Maple Park, Illinois, about an hour west of Chicago. I've been a sports medicine trained doctor who enjoyed primary arthroplasty, trauma, community practice. And I practiced clinically over 35 years. I got into consulting and trying to make a bigger impact on patient outcomes in the last year when I left my clinical practice to try to use my experience and insight to improve digital programs, planning programs, patient optimization, the whole digital ecosystem that's developing around the patient experience.
Yeah, that's very interesting. You've had quite the career there, quite the career. And thank you for everything you've done for us in orthopedics as an industry across America and for your patients too. I'm sure there's a lot of patients that are now out of pain. So, and doing the things that they wanted to do. So when you started your career, you probably started in such a way where patient optimization may not have been a usual part of care. And now it is. You've done things like you started a bod squad and follow the bod initiative. So what inspired that? And how has that impacted your career and your patients?
Well, yes. When I started in my training in the 80s, if a patient was going to have a joint replacement, they entered the hospital the night before surgery, was seen by anesthesia. We did some blood work. They had their operation, and then they stayed for 2 weeks in the hospital.
2 weeks.
2 weeks.
All right.
So the evolution has been just remarkable to today, where patients come get a joint replacement and go home 3 hours later. And so this whole world of optimization, efficiency, value-based medicine uh, has all uh, evolved so quickly and has become such an important part of practicing medicine today.
Mhm. Excellent. So each podcast, we're going to do a unique question. And I want to start off before we dive even deeper into that with our unique question. And it's one that focuses on an opinion of yours, but then is rooted in fact, and it all deals with lifestyle health. So here we go. So if you had to choose one food to eat for the rest of your life, what would it be?
Oh, that's a tough.
That's, I mean, that's hard and limiting. Sure.
Yeah, it's tough. The first thing that comes into my mind is a powerful green vegetable.
Okay.
Something that is going to provide as much nutrition on its own. I don't think there is one perfect food that provides you everything that you need,
Yeah.
but I believe that plant-based diets overall are healthier for you.
Excellent. Excellent. And I would choose steak or something like that. So there you go. That's yours is much better. But and so okay, so the fact of this is that you're right. Potatoes with the skin on is number one, according to a nutritionist out there, and then whole eggs comes in a close second. So I think those are our facts.
Well, yeah, you're trying to get one food that provides everything.
Right.
Yeah.
Right.
Good.
That's difficult. Yeah. So that's great. That's great. All right. So turning to some topics on, proactive, preventative care. So you've said, and quote, healthcare is helping people to not get sick and to fix them when they are. So, and that preventative is the most powerful medicine. So, how does this philosophy shape your approach to orthopedic care? Maybe you have some examples or something to guide the listener here.
Well, orthopedic care, like most of medicine, is geared towards fixing problems as opposed to preventing problems. And that's one of the reasons that now I'm consulting rather than treating, because I think that I can have an impact in uh, the higher value options.
Mhm.
So prevention is clearly the highest value. You get the most bang for your buck by preventing a problem from occurring. And
Mhm.
that speaks towards the optimization programs that patients should have prior to surgery. And if you extend that further, optimization of your health. Health care means to care for your health. It doesn't necessarily mean to care for your sicknesses. And
Mhm.
trying to keep people healthy is a much higher value proposition than taking care of them when they're already sick.
That's a great way to look at it. You're right. Breaking down that word just has such meaning behind it. And oftentimes we confuse that meaning with treating something that's already there. So as you look at that, and you're specifically orthopedics, how do you see that the industry will shift from reactive to proactive? What kind of things maybe have you seen from the start until today? And how do you really know what to choose or what's right, or where does the scope of that extend kind of when you look at reactive to proactive care?
Well, proactive is health maintenance and health improvement, and reactive is trying to fix people when they're already uh, not healthy. So, surgical optimization is taking people who already have health issues and trying to improve them.
Mhm.
Health maintenance is to take people and improve their health and try to prevent them from getting sick, or try to cure things easily so they don't show up.
Mhm.
Treatment is actually the last as far on the value scale. Treatment
Mhm.
is already trying to take care of a failing proposition.
Mhm. Yeah, absolutely. And so when you look at this from, let's just excuse the patient side of this and the benefits there, but the provider side, you know, can you share an example when you've seen some sort of optimization make a significant difference for the patient and for you as the provider?
Well, it's very well known in orthopedics and the joint replacement world, the spine world are very much attuned now to optimization because it's clearly linked to complication rates. So
Mhm.
you take somebody who has the classic American weight problem and a very high BMI, where they have significant chances of multiple complications, which now insurers don't really pay for to take care of the complications. And you actively try to optimize them, get their weight down, lessen their risks. You do your surgery, and the patients have an uneventful recovery, are very happy, great outcomes. And that's what you try to do when you're in the treatment world.
Mhm. And I mean, and when you're doing that, the patient comes to, a better place as well. So they get further education. I mean, to ensure the outcomes, the approach is a little bit different to the way that they have surgery or the way that they're receiving conservative treatment. So how do you, think that orthopedic surgeons, or how have you inspired patients to embrace that proactive mindset, manage their own health, to stay ahead of the game kind of deal?
So the surgeon's job has expanded to include the optimization of their patients. We recognize the problems that we need to fix. So the surgeon now has to set the expectations, set his guidelines, and communicate that. And that's usually done through joint classes
Mhm.
and discussing with the patient the risks that their medical problems uh, have.
Mhm.
And then you have to have a system in order to get the perfect optimizations for your practice. I mean, there's
Mhm.
lots of models that are devised in academic settings, private settings, small practice, large practice, but everybody has to have very well developed optimization program to have the best results for their patients.
Sure thing. Sure. And so when you look at this, I mean, it's almost like a triangular sort of thing, right? Which is the strongest shape, strongest force out there. But when you remove a piece of that, then it's not. So if the patient is ready for it, which they might, go off of the provider's recommendation. And then from there, you have this program, you have the professionals and folks, or whether it's virtual or in person that are operating it, that's great. What do you say to the surgeon that says, it's not my role. This is not my scope. I'm here to fix their knee. I'm here to look at their hip, to do the replacement, to reconstruct it. It's that's not me.
And well, that's 90% of orthopedists. That's why we went into orthopedics. We want to operate, we want to fix people, we want a short interaction where we get in, fix, get out, and make people better. That's what we're geared emotionally, professionally. That's what we do.
Mhm,
But the world has changed, and so in my mind, what the best system for an orthopedic doctor is to create a system. Uh, everybody needs optimization. You need one point of contact that you can trust and interact with that can offload this, which is medical management of patients' problems and return them to you in the condition that you want. Most
mhm,
orthopedists don't want to take time managing people's BMIs or their A1Cs. And a lot of times when you send patients out to their primary doctors or to certain specialists and try to intervene, it's just not coordinated enough. And the patients don't succeed in becoming optimized. And it's a point of frustration for a lot of orthopedic doctors.
mhm. And the patients alike. I mean, they're getting sort of ping pong back and forth, right? If you consider that they've come from a primary care referral to an orthopedic, surgeon, and then the orthopedic surgeon is saying, "Well, wait, you have to go back to primary care to get optimized, and then you can come back and see me." You just played a nice game of pong back and forth with your patient right there.
Yeah,
Very
and then you go see an endocrinologist and a bariatric person and this and that, and and it's just not an efficient system. So
yeah.
taking this and making it an efficient system
Mhm,
that offloads the orthopedic surgeon or the orthopedic practice and does the job, takes the patient, does the work that needs to be done. There's a lot of legwork in this, and that has to be done. And sometimes there's a lot of hand holding that the patients need, education and guidance to get through it. And that system can work in synergy with the orthopedic practice.
Okay, so Dr. Bodner, if you had to design the ultimate patient optimization toolkit, what you think is really necessary in there, what, let's say, 3 tools or strategies would you include?
First, for the surgeon, I think, as I said, the surgeon needs to be very clear with his patients of what the guidelines and expectations are of the patient. And this does go towards the educational point of it. The system for most communities, orthopedists, should have a single point of contact. You don't want 20 different specialists doing their own thing because it's not efficient. So a single point of contact that is overseeing the optimization process, and then excellent communication and follow up between the doctor staff and the optimization team. So you're monitoring progress and getting a better idea of when this patient or if this patient is going to make it and how to provide the most help for the patient to do it and get through it.
And that sounds like a patient advantage too. I mean, then at that point, they have one point of contact for themselves. They know from start to finish, here's where I am and here's my targets. And they're able to then work towards those. And when they meet the goal of that the provider has set, like you said, they provider knows, and it's almost like the bell's ringing and they're ready to go. They're able to get their surgery. They're able to then recover better. They're able to see better outcomes to get to doing the things that they love.
So, from the patient standpoint, a point of contact for the doctor, a point of contact for the patient, because the patient need coaching, they need guidance, they need encouragement. It's not easy. These are not easy. And not being alone, having somebody to help.
So we talked a little bit about sort of the need from a high level umbrella standpoint to how are we doing this, the mindset, let's get down to the components of it. So you consider an optimization program. What are the key components, from your standpoint that you believe should be in that program, either pre-surgically, post-surgically, any perioperative or conservative treatment? Like what would that look like, for you?
Well, there's been a lot of work done in surgical optimization, and people like Kevin Bozick and Antonia Chen have really done remarkably good work on this. And there's lots of different factors. I sat down and I said, well, what's the low hanging fruit? What's the parameters that you get the most bang for the buck that are the most prevalent? And I said that you have the weight or BMI, you have the management of diabetes, type 2 diabetes, especially. You have the nutritional status of the patient, be that an overall nutrition, or even in the metabolic world, osteoporosis, which has a huge impact on joint replacement, spine surgery,
Mhm.
smoking cessation programs, anemia is very big, sleep apnea, which is a problem that exists pre-op and mostly post-op complications. You
Mhm.
have things like the opioid use before,
Mhm.
uh, psychological status such as
Sure.
depression and anxiety disorders that have a huge impact on outcome. Those are 7 that I just ripped off that can be managed,
Yeah.
and improved.
Mhm. So, I mean, you're getting into, the physiological health of someone there that's, outside of just that musculoskeletal issue. You're looking at, okay, how are they preparing for, recovering from? What kind of components and things and issues could arise, that maybe we don't think about? Like, someone's lonely, they're depressed, they're sitting there, they're not able to do what they want to do. It's weeks on end that they're trying to recover. I mean, maybe not eating correctly. So that contributes to things too. I mean, all of that carries a lot of weight and gravity in how someone is going to recover and their outcomes, the effectiveness of you as an orthopedic surgeon's treatment there. So if you were to say, to the patient, what's their strategy to be able to make this happen? How do they do this effectively? What's that patient's how should they go into this with their mindset?
Well, the patient is just going to the doctor. They got a bad joint. They've been told surgery may be helpful for them. And then they're told, hey, you have some issues that can really have a big effect on your outcome. And we want to avoid complications. That's what the surgeon's goal is, to get you through safely. So, to deal with the factors that cause these complications, we need to help you to improve yourself to get to a place where you have a much higher chance of getting a good outcome without complication.
Mhm. And I mean, from the patient's perspective, they're going in to see a surgeon for a knee issue and they're being told, oh, you should lose some weight, or you might have type 2 diabetes that's going to affect your recovery, or smoking is something that, affects your musculoskeletal issue. So that confusion there, it seems to happen, right? We've seen articles in the paper at New York Times about, patients having trouble with seeing their doctor, and from their perspective, it's trouble, right? And then they're told, man, you have to lose 20 pounds before I can operate on you. You have to be sub 40 BMI, all of those things. So mindset is very important. So when you look at that, how can the provider deliver this message? Some of them might say, is this my job? Or, we kind of
Well,
talked a little bit about that, but what's the
the
best way?
the provider has to understand
Mhm,
that the best that they can do is to control the domain of that patient.
mhm,
And that domain of the patient goes beyond the knee or the
mhm,
hip or the back that you're dealing with. You want to guide the patient through the process.
mhm,
And these days, the process includes optimization. It's that simple because just looking at a patient and saying, it's not 20 pounds, Brock. A lot of times it's 100 pounds.
mhm.
It's 100 pounds and their diabetes is not well controlled. Their hypertension's not great. And they just want their joint fixed. They just want their operation to be out of pain.
Mhm.
The doctor now has to understand that he is the conductor here, not just playing his fiddle with his knife and his implants.
Mhm.
He has got to help, or he has to be smart enough to be part of a well organized system that does what needs to be done today.
That's great. That's great. I understand that. And I think, when delivered right, the patient would too, right? There's a belief system there. There's an understanding. It's not really belief, but it's guideline based, it's science based and studied, backed by studies. So when you look at healthcare challenges, value-based care, that topic, what do you see as the biggest challenge in orthopedics today?
Well, frankly, it's economic.
Okay.
The biggest challenges are that the government has decided that they don't want to pay doctors or that they can keep decreasing their payments and rely on them to increase their volume instead. So getting paid so you can keep your lights on, it's a challenge.
Mhm.
And so getting reimbursed for preventative care is probably the best money spent. And as I said, the best money you can spend is on keeping people healthy and avoiding disease. Though uh, the system works on treating people with disease, or it, it's a it's a system that takes care of sickness and is built around illness and not built around prevention and wellness.
Mhm. But and to further that too, I mean, when we're talking about optimizing a patient, I mean, they're being seen for the musculoskeletal issue, right? And then we're saying, okay, you have all of these other diagnoses, or and so we're gonna treat those as well. So we're really just comprehensively caring for the patient. I mean, in some ways, that still is treatment. It just may be a little bit broader, scope from what they were initially thought they were being seen for, or what the provider did. But I mean, it includes some treatments in there that are fair enough to help that patient's musculoskeletal status too.
Now it's like there's two worlds. I mean, everybody is out there doing things to be healthy, joining health clubs and getting food supplements and doing fasts and doing this.
Mhm.
And that's so then there's the health world, and then there's the sickness world, the illness and disease world. And they're like separate, and they really shouldn't be. The healthcare world
Mhm.
should spend as much time on prevention, which is the highest value when you talk about value-based care.
Sure.
It just doesn't it doesn't make the machine of big pharma and uh, the whole industry that's set up to treat diseases work well, but it's by far the best value you can do is to stay healthier.
Yeah, absolutely. And so you mentioned it, value-based care a couple times. What does that mean to you? And how can you relate to other healthcare providers, how to embrace it?
Well, yeah, I mean, the doctors understand value as quality over cost. So they're trying to increase quality, decrease costs. But the incentives that increase the quality and decrease costs actually have to do with prevention,
Mhm.
early diagnosis, you know, things that cure problems so they're not a problem anymore. And then finally, treatment, then the most quality over cost treatments. But you're already at the end of the line when you start talking about bang for the buck on treatments. Treatments are expensive. And then the complications that occur with treatments are very costly.
Mhm. Yeah. I mean, when you look at it from a patient's perspective, so really in a value-based arrangement, you're kind of getting more for what you signed up for in some ways, right? It should be more quality care, more comprehensive. It's going to be bubble wrapped, protected, for the patient, to recover better. I mean, it kind of then is more of attractive quality for the provider from the patient's perspective to say, hey, I'd love to come into a practice that looks at me as a person and not just my knee.
Everybody hopes that.
Mhm.
Everybody hopes for that. But
Mhm.
subspecialization is so fragmented these days that they come in and, hi, I only take care of your knees.
Mhm.
Not
Mhm.
not do I take care of your type 2 diabetes or try to help you get healthier. I only take care of your knees. You have a hand problem, go down the hall. You got a back problem, there's someone else.
Sure.
It, there is not a holistic sort of or a comprehensive health initiative built into all these subspecialties.
Mhm. Absolutely. So, all right. So we're going to just first break here for a second. Our optimized podcast signature question. This is a question we're asked every guest here. If you could give every patient one superpower or piece of advice to optimize their health and transform their health and their life, what would it be and why?
Well, I would put it this way. I want you to either walk or run away from ultra processed foods that you find in your grocery store. Grocery stores are absolutely death traps. When I walk 'em and down the aisles, I am just astounded by the amount of poor quality foods that's being provided for people in our country. So walk and run has to do with exercise daily. And
Mhm.
second, probably the most value you can do for people in the United States would be to improve the diet,
Mhm.
which is a complex issue because it has to do with education and costs. Good food isn't cheap, but that's it.
Mhm.
I think if you improve people's diet and they did exercise, probably 35% of the most common disease states that complicate the orthopedic world would be way less.
Wow. That's a big impact. Certainly. So anything else? So anything else that you'd like to discuss today or, what's other piece of advice or anything on the topics here that we've discussed that you can offer and you'd like to.
I think the message that I've had a lot with the optimization end of this is you might just, you might just get one chance at it. Meaning when you see the patient and you're going to operate on a patient, you should spend as much time preoperatively optimizing and planning your surgery as doing it.
Mhm.
Because once you get a problem, it's a downward spiral. So you may only get one good chance to make it right for the patient and spend the time and uh, invest in resources that will optimize your outcomes in your patient. And,
That's great.
and most part, I think in orthopedic practices, it just has to be with a partner that is committed to the job of optimizing health and preoperative status for the patients.
That's great. That's great. Well,
That's why I'm here, Brock. That's why I'm here, because I believe this with all my heart.
I can tell that. And when we met early on at OSET in 2024, you could tell that right away. I mean, having a good glass of red wine, was Veritol, over there, and discussing this topic, it was great. So it's, hashtag bod squad, follow the bod. I mean, where can listeners find you? Where can they get a hold of you if they want to?
Well, my social media presence is to teach. I got on this to teach this hip spine biomechanics that was so difficult for surgeons to understand. I went on to LinkedIn because my audience is the orthopedic world.
Mm-hmm.
Now it's actually not my audience, it's my family, which has been an incredible gift for me. And that's where you find me. I mean, I spend a lot of time on LinkedIn interacting with people, trying to bring people together.
Mm-hmm. That's great. That's great. Well, thank you for joining us today very much. So
Thank you for having me, Brock. I look forward to this.
Yeah, thank you. So that's a wrap for today's episode of Optimized, where we empower providers to enhance patient care. We appreciate you joining us as we explore the innovative ways to improve patient outcomes through lifestyle health. If you found today's discussion valuable, please be sure to subscribe, share this with your colleagues, leave a review. It helps us to continue delivering content that supports you and your practice. Thank you very much.
Thank you for listening to this optimized podcast episode from Prescribe Fit. Make sure you never miss an episode by following the Optimized podcast in Apple Podcasts, Spotify, or wherever you listen. If there are any topics or guests you'd like to hear on our show, email your suggestions to optimized@prescribefit.com. And to learn more about Prescribe Fit's virtual lifestyle coaching and remote patient monitoring program, visit prescribefit.com.